Hi, my name is Sharon. I am coming to you today with a proposal to develop a patient education handout to discuss bone density screenings. These exams are extremely important in maintaining bone health and in helping doctors prescribe the proper treatment for osteoporosis. Unfortunately, it's come to my attention that many of our patients are no-showing these exams. The reason for this is because a lot of patients have never heard of a DEXA or bone density screening. Many are under the impression that they're going to be put into an enclosed tube like the ones used for an MRI, or just aren't sure what this exam entails. I think that's why it would be a great idea to develop this handout so that they are better informed about this exam and will persuade them to keep these appointments. I briefly developed here a handout that we can use as an outline to develop our own. We can use some of the similar topics as to what bone density is, how these exams are performed. It would be a great idea to include a picture of a DEXA machine so patients are familiar with it and understand that it is open. Another section we can use is preparations for the exam, as well as a quick reference chart to better understand the results. In order to develop this handout, we will need the help of our physicians in the endocrinology department, as well as some of our radiology techs who are familiar with DEXA machines. These texts can help us explain in greater detail how a DEXA machine actually scans and measures bone density, while our endocrinologists can help us explain in simple terms that patients can understand what bone density is and how to read results. Once this handout is developed, we will need to translate it into the different languages spoken by our patients here in the facility. This will help us maintain class standards. It is extremely important for patients of all languages and cultural backgrounds to understand what bone density screening is, as it affects everyone. Patients keeping their appointments for these exams will help us keep no-show appointments down. It'll help patients better understand the severity of bone health so that they will better care for themselves to prevent future fractures. This will also help us maintain fracture care costs down. I hope you take this proposal into consideration, and I appreciate your time. Thank you.